Good afternoon, everyone. Welcome to today's webinar on resource mapping, a strategy to enhance collaboration and referrals. We are very happy to have you all with us today. My name is Brittany Taylor. I work with the LEAD Center, which is a project of National Disability Institute, and I will be moderating today's webinar. But before we get started, I'd like to go through a few technical, logistical slides so each of you can enjoy listening to today's webinar and learning in the most effective way. The audio for today's webinar is being broadcast through your computer, so make sure that your speakers are turned on or your headphones are plugged in. And please note, you can control the audio broadcast via the audio broadcast panel to do things like turn the audio up or down. And if you accidentally close that panel, you can easily reopen it by going to the Communicate panel. It's up at the top of the screen and choose Join Audio Broadcast. If you do not have sound capabilities on your computer, or if you prefer to listen by phone, there are a couple of numbers listed. I'll read them off in a moment, and a meeting code that you just need to enter. And those numbers are 1-650-479-3207. And a toll-free number is available as well at 1-855-244-8681. And today's meeting code is 408-021-185. And please note, you do not need to enter an attendee ID when requested. Real-time captioning is being provided during this webinar. To access the captions, click the Media Viewer button at the upper right corner of the webinar platform, and that will automatically expand it up for you. For Mac users, the Media Viewer panel will automatically be open in the lower right corner of the webinar screen. And if you want to make the Media Viewer panel larger or smaller, you can minimize other panels like chat, Q&A, and/or participants. We will be having a Q&A portion during today's webinar. Please use the Q&A box to send any questions you have during the webinar to me, and I will direct the questions accordingly during the Q&A portion. If you are listening by phone and not logged into the webinar, you may also ask questions by emailing me directly at btaylor@ndi-inc.org. And please note that this webinar is being recorded and materials will be shared with participants within a week of the webinar via an email. If you experience any technical difficulties during today's webinar, please use the chat box to send a message to me, or you can also email me. And again, my email is btaylor@ndi-inc.org. And with that, I am very pleased to reintroduce our speakers for today's webinar. Mike Klinger, he is a work incentive specialist and grants and special programs for the Virginia Department for Aging and Rehabilitative Services, and Elizabeth Jennings from the LEAD Center, also a project of National Disability Institute. Thank you so much, both of you, for being on today and for sharing some really important information on resource mapping and how the state of Virginia and DARS and DVBI will be using resource mapping to enhance the services that you all provide. Thank you, and Mike, I'll hand it over to you.
Well, thank you, Brittany, and good afternoon, everyone. I wanted to start out with a brief overview of the Career Pathways for Individuals with Disabilities, or CPID grant, because the partnership that we have with NDI to do these financial empowerment webinars, as well as some of the other initiatives that we are working on, are part of the CPID grant. So the CPID grant is funded through a federal grant from the U.S. Department of Ed, and it's led by DARS and DBVI with the goal of helping Virginians with disabilities enhance their marketability in high-demand jobs. And one of the ways that we're doing that is by incorporating financial empowerment training into the curriculum for students who are undergoing a training program at Wilson Workforce and Rehabilitation Center. One of the ways that we identified the need for financial empowerment training was by using our upcoming financial health assessment that we'll talk about during the next webinar in December to help clients identify what some of their financial goals were in terms of education and needs when it came to financial empowerment. One of the things that I found interesting was that many of the people answered on their FHA that they had not reviewed their credit report and they did not know their credit score, but yet they knew enough that negative or no credit was a factor in them being denied employment and housing. So they knew that they had an issue in terms of finding employment. They knew they had a barrier, but they weren't exactly sure how to address that barrier. So one of the things, the main goal of what we're doing with these initiatives under CPID is to help clients come up with strategies to address some of those barriers that they need help in overcoming. And with that, I'll turn it over to Elizabeth.
Thank you so much, Mike. I just want to take a moment to advise all of you that we are so pleased at the National Disability Institute to be part of this project and very grateful to the Virginia Career Pathways Project for including us. For those of you on the line who may not know about us, here at National Disability Institute, our mission is to drive social impact to build a better economic future for people with disabilities and their families. And you can learn more about National Disability Institute on our website, www.realeconomicimpact.org. There you'll find a host of webinars and archived webinars that you can participate in, along with other tools and resources as you move forward in building your ability to support people in building their economic empowerment. I also want to let you know that we're able to be here with you today thanks to our LEAD Center, which is a project of National Disability Institute. We're funded by the Department of Labor Office of Disability Employment Policy. Our LEAD Center mission is to advance sustainable individual and systems level change that results in improved, competitive, integrated employment and economic self-sufficiency outcomes for individuals across the spectrum of disability. At our LEAD Center website, www.leadcenter.org, you can also find a host of resources both on employment strategies and economic empowerment strategies, along with different public policy initiatives that you can review in your efforts to support people in building their employment as a pathway to economic self-sufficiency.
Okay, thank you. Just quickly want to go over the agenda. So the first thing we're going to do is review the webinar objectives for today. We'll do a brief overview of the Financial Capability webinar series, talk a little bit about the webinar from last week and the one for next month. But our main focus today is on resource mapping. We're going to talk about what resource mapping is. Elizabeth is going to go through some tools that NDI has developed to help service providers come up with a resource map. And we'll talk a little bit more about how the resource mapping fits into our existing criteria for delivering our services. And as we go along, you'll find that it's not very much different from services we're already providing, and I'll give you some examples of that on a later slide. So a lot of the objectives I've already gone over. Again, we'll talk about what resource mapping is. We'll talk about some of the services and supports that are out there to help a client achieve their financial goals and provide some specific resources of how to put together a resource map and what a resource map looks like. Next slide, please. Wanted to briefly touch base on the Rehabilitation Act of 1973 as a little bit of background on how we got here. Most of you on the line are familiar with this act, but the purpose of it is to empower individuals with disabilities to maximize employment, economic self-sufficiency, independence and inclusion, and integration into society, with an emphasis on economic self-sufficiency. Because as we all know as service providers, our job doesn't always end when a client goes to work. Our ultimate goal is to see them and help them work off the Social Security benefits, move into full-time employment, and build resources for their future. Next slide, please. That's kind of a nice segue into the next slide and how we get here. Like I said, we determined that clients need additional supports to maintain their employment once their VR case is closed, and the access to those kind of supports upon case closure reduces recidivism and duplication of services within the system, as well as increasing the client's likelihood of keeping their jobs, allowing them to build savings for the future. Now let me give you an example of how this works into some services we're already delivering. For the VR counselors on the line, you have clients that come to you that are on Social Security benefits that want to work, have questions about how that work is going to impact their benefits. So we have a Work Incentive Specialist Advocate, or WISA network, and we have community partners that employ those WISAs. So it allows our clients to receive access to things like work-world benefits analysis, work incentives counseling. The WISA can talk with the client a little bit about what their reporting responsibilities are to Social Security when they start working. And so because the client has access to those services that we've embedded into our WISA network, they are more likely to be successful in the jobs they're placed in because there are no surprises when they go to work. They have a pretty good idea about what will happen to their benefits as they go to work. But think about what would happen if they didn't have access to those services. Maybe the client didn't understand their reporting responsibilities when they go to work to Social Security because they didn't have access to a WISA. What's going to happen? They're going to go to work for a couple months, maybe get a overpayment letter from Social Security, and the first thing that they would think is, well, I'm going to quit my job. So you may see folks in that situation coming back to you in 6 months, or they may not. They might get frustrated and just, quit their job and not look for work. So that's an example of why it's important to build these community resources and why it's important for clients to have financial education and empowerment prior to beginning work. It leads to a much more higher likelihood of a successful employment placement. Next slide, please. So just to give you a little bit of rundown on the Financial Capability webinar series and our goals, the purpose is to address a barrier to work through a lack of financial resources, and our main goal is to equip the current WISAs, the DARS or DBVI staff, and any vendors working with clients on the education and resources necessary to build financial capability of customers and maximize their potential for long-term employment success. We talked a little bit, if you were with us in the last webinar, about the Your Money, Your Goals initiative and how we were training direct service staff around the state on how to use those tools and apply them to the clients that they're working with. We'll talk a little bit about that next time, but that's an example of one of the initiatives we're working on that can help with that. So our goals for you as participants at the end of the financial webinar series are a couple things. One is that you will better understand the lives of the customers that you serve and how their impact in employment goals and job search is impacted by their financial needs. So, do they need credit counseling? Do they need budgeting skills? Do they need help with keeping a budget? Are there things that you can help them identify, resources to help them overcome to further their success in employment? We want you to be able to shift a focus from employment as a goal to employment as a stepping stone to economic self-sufficiency. So talk a little bit about that briefly in the last couple slides, but working is great, placing a client in a job is great, but really ultimately, we would like to see every client, if possible, work off of benefits, work full-time, and have access to resources that can help them save money and accumulate resources so they don't have to live in poverty. So we want to shift focus from just working to focusing on how they can keep that job long-term and accumulate resources for the future. And then to connect consumers to financial opportunities so they can capitalize on economic self-sufficiency that can come from employment. I'll go through some specific local resources in a minute that clients can use to further their financial education and empowerment and learn more about those things. Next slide, please. Next slide is just to save the date. I talked a little bit about our next webinar on financial health assessments coming up on December 7th from 2 to 3. And if you're on the line today, you would have gotten an invite to the next webinar as well. And I encourage you to attend if at all possible, but also, please share the invite with your colleagues as appropriate. Encourage other staff within your organizations to attend too. This is particularly helpful to the WISs and VR counselors because the financial health assessment is going to be an upcoming billable WISA service, and so you're going to want to find out more about that. So please, please attend if at all possible. Okay, we're going to talk a little bit about resource mapping in specific. Next slide, please. So what is resource mapping? So resource mapping offers a strategy that can help leverage a community and organization's capacities to serve individuals. And it helps clients and their service providers to identify community resources that can help clients work towards setting a goal and achieving the desired outcome. So in other words, resource mapping is a strategy that employs the use of several different community organizations that work together to help a client achieve a common goal. And these kind of partnerships are important because, as we all know that work in VR, it's impossible for the VR system to serve every need of every client that comes through the door. Just not feasible and practical for us to do that. So it's important for us as service providers to identify other resources in the community that can help the client reach their goals as well. Next slide, please. So the importance of resource mapping. We talked a little bit about the first one. It's an important strategy in integrated services. It provides an opportunity for blending and braiding of resources amongst a variety of organizations and assists in identifying the gaps within the community to assist individuals build their financial well-being. Just to give you an example of that, the ticket to work handoffs that the VR counselors help initiate is an example of how we can blend resources together. So you have a client who has been working for 90 days, successful placement, the VR case closed, and then you as the VR counselor hand the ticket off to one of the employment networks if a client needs additional services in order to keep the job that you placed them in. So, for example, they might need some additional work incentives counseling, or they might need job coaching services that can be provided by one of these ENs. So that's an example of the client working with DARS and then working with an employment network to continue to receive services that they need to keep the job. So it's an example of how we've already blended the services of both VR and employment networks together. That's an example of resource mapping. And as you can see, it's not a foreign or new concept. It just fits into services that we are already providing. Next slide, please. Okay, so it also enhances cross-collaboration between agencies working towards the same goal of economic self-sufficiency. Again, the ticket to work is a good example. the employment networks and the VR agencies have the same goal of providing the services to the client that allow them to both obtain work and retain it once they get the job. It enhances referrals to other organizations that can assist an individual in achieving the goals and creates an opportunity for soft referrals versus hard referrals. And I can give you an example of that on the next slide. Next slide, please. Okay, so a soft referral or a soft handoff is a referral that a person or organization makes to another organization that they have a contact within. An example of that would be a VR counselor handing a ticket to work off to WISA, a work incentive specialist advocate that is also affiliated with an employment network. So let's say the client has been receiving services from the WISA work incentives counseling when the DARS case is open, and then the VR case is closed, and the client needs additional work incentives counseling. The DARS counselor hands the ticket to work off to one of the WISA affiliated employment networks to continue that employment counseling. Because the DARS counselor already has a relationship with that WISA, and because the client already has a relationship with that WISA, that's an example of a soft referral where there's already been a connection between the referring agency and the other provider that's already been made. A hard referral is when a referral is made within an organization to another organization where the person doing the referral does not have a contact with the organization that they're referring to. I'm going to talk a little bit about who should be encouraged to complete a resource map. And there's a wide variety of people that can do this. A case manager, an employment specialist, not on here, but maybe a job coach. A financial coach would be appropriate. Work incentive specialist advocates or WISAs as part of an organization, coalitions and work groups, or VR counselors. And I'm going to hand it off to Elizabeth, and she's going to go through some examples of how to put together a resource map.
Great. Thanks so much, Mike. And thank you all of you for being on the line today. It's really exciting to get to talk to you about this. We're going to go through how you get started doing a resource map, but I just want to follow up on Mike's last comment. You know, when you are part of an organization, whether it's big or small, you want to bring together several people to help you create this resource map. And that might mean you carve out time to work on it all together, or you play relay with it and you each provide content to it separately. A great idea is to even get the people you're serving involved. So if you have a consumer advisory group, or you have folks that you feel like have been able to move forward far along the employment path, that you help them to help you think through who are the resources that were helpful to them in getting that done. You know, nobody knows about services like people receiving them. So keep in mind the folks that you have available to you and the deep knowledge they have about what really goes on in their community, especially when they need something. So speaking of needing something, we thought that folks might need some handouts that would assist them in completing a resource map for their area. So we have those handouts ready for you. Brittany's going to put a link to a Dropbox in the chat box for everyone. They were also posted as part of your registration, and if neither opportunity to pull down this tool works for you, just please feel free to reach out to us. You'll have contact information at the end so that you can utilize these tools that we've created for you. It's going to look a bit like this. We have a kind of a document that gives you different areas that you want to be thinking about, and those areas match up with our core service areas. So when we think about an individual having a brighter financial future, piecing together all of the things that they'll need, we think about their public benefits and work supports. You've all experienced that individuals need to have an understanding about that. But it's not just an understanding. Many people are spoken to or receive information or guided through understanding their disability benefits and the work incentives, but then using them can often be a second and separate step. So we want to think about those two things. Another area is employment. What are all the different employment supports that are available to an individual? A third is free tax preparation and the earned income tax credit. We still have about 20% of people with disabilities who do not claim their earned income tax credit and leave that money at the federal table. A fourth is financial education and financial coaching, which you've learned about over this series. And the fifth is asset development. And with the new opportunity of the ABLE accounts, we want to make sure that people recognize that having the opportunity to attain assets, particularly those that are going to improve their quality of life as an individual with a disability, is really no longer off the table. However, we do want to recognize that people are starting off at a very low level of income, low level of assets, and in some situations, a low level of knowledge on how to make all of this work. So we're not saying everybody's going to do asset development right away, but we do want to keep in mind what those resources are in your local area as people head down the road to that area. So those are our 5 key strategies. It's what we think about each time we think about financial stability. And we've often debated about what a graphic for this should look like. The graphic we have here shows each of the areas kind of centered by a goal and moving in a loop, but we don't think they're sequential. It's going to be different for each person, and it's going to depend on their individual circumstances, but most of all, it's going to depend on the connections and the opportunities that they're connected to. And that's why a resource map is so important. None of us as individuals who are providing employment services or benefits planning or financial coaching can really be expected to know everything. It's going to take a village. So the resource map is your guide and your consumer's guide to who is in that village and how you access them. So the first step is to identify resources and tools for each of the following strategies, the 5 that we talked about: public benefits and work supports, employment, free tax preparation and the Earned Income Tax Credit, or EITC, financial education and financial coaching, and asset development. Now, if you were ahead of the game and you noticed the tools when you registered and printed that out, that's great. You can make some notes as we go along. If you want to throw some thoughts into the chat box, I want to invite you to do that. But as you look at step 1, you want to be thinking about what are resources and tools that apply to each of these areas. So I'll take you down a quick side path. When I was first doing employment services for people with disabilities, I was going to leave the field and find something else to do because I just didn't have any knowledge about people's public benefits. And I thought, this is impossible. I don't know how to make this work if individuals have all of these complicated benefits that I don't know anything about. So I would tell you right away, one of the resources and tools that I would want to see under step 1 is understanding SSI, SSDI, Medicaid. And you can see we started to fill it in for you, just some examples. SNAP is another one. And one of the resources for that understanding is the work incentive specialist. Under employment, at step 1, you might immediately start to think of who provides it, but you want to be thinking about what are the tools, what are the resources that I want people to get when they make that connection. So for some of the folks you're serving, it might be discovery. The discovery process offers a way to identify the ideal conditions of employment for individuals and can be also a great way to unearth some of the challenges that have been keeping them from employment in the past. You might also do a career assessment. Under free tax preparation and EITC, you want to think about VITA and My Free Taxes. You know, really, those are kind of the tools that help with that. But you might take it a step further to say, I want people to be identifying What are their expenses, their qualified disability expenses, and how are they going to do that will come a little bit later. You could be looking at tools like the Money Smart curriculum and the CFPB Your Money, Your Goals with the Disability Supplement that has been delivered through Virginia. And under asset development, you might be thinking about individual development accounts and ABLE accounts. And there's many, many more tools and resources that will come to mind for you. And we're going to show you a few examples in just a little bit. But that's what you want to be thinking about in step 1. Then you want to take it a little bit deeper. In step 2, you're going to be thinking about the resources and tools for each strategy that are offered by your organization. So you're going to kind of go a bit deeper starting at home. What are the pieces of this puzzle that we as an organization already offer? And some examples of that are benefits counseling, if you're currently providing that in Virginia, if you're a WISA and providing WISA services. You might be offering a range of employment services, including job coaching that you'll want to document there. If you are making connections to VITA sites, maybe you already make those hard or soft referrals to the VITA sites. You want to be able to note that. You might be doing not as much around financial empowerment since this is just kicking off in the state of Virginia, but if you are a WISA and you're attending the financial empowerment trainings, you're on the line today, you might want to make a note of that so you're thinking about this is a real resource that we're bringing to the organization. And then you might also be taking advantage of some of the new DARS-approved services like assistance with opening an ABLE account or helping someone start an IDA, and you'll want to note those under asset development. So you've started to identify the resources and tools, you're identifying what's offered by your organization, and then in step 3, you want to take it to the broader community, and you want to identify who in our local area is providing some of these services. And this is probably the harder part, because for many of us, when we're working in disability services and employment services, we're not necessarily engaged with people who are doing financial empowerment and asset development, which is why we think resource mapping is such a great idea. So as you're thinking through who some of those folks are, we have a couple of examples for you. So of course you have the WISAs, and I saw a few folks are on from other states, so in your local area it might be the WIPAs, the Work Incentive Planning and Assistance Projects. For employment, you have your state-funded agencies, your VR in Virginia, it's DARS, your Divisions of Blind Services, DBVI in Virginia. And then you also want to remember your workforce centers, those American Job Centers that oftentimes are kind of the forgotten, really pot of gold in many local communities that offer a range of employment services that individuals can utilize while they're utilizing other services, and both systems get credit for the individual attaining employment. Another one that we didn't include under employment, but I want to add now, is the Ticket to Work program and those employment networks that are going to provide the additional supports and services somebody will need after their case with the state agency is closed. So that's another great resource and tool you'll want to keep under employment. For free tax preparation, again, you want to be thinking about who's running the VITA sites. So in your local area, United Way is often somebody who does that, and many other disability and non-disability organizations who provide that service. For financial education and financial coaching, you're going to have a range of opportunities here. One that we feel people often forget about are the cooperative extension programs. In most communities that have cooperative extension, they're providing some level of financial education, and that's a great place to make a connection that you may not have thought of before. On other times, you may have heard us also share that in addition to the different tools and resources that are available online, your local bank is also a resource for you, as they oftentimes provide free financial education classes and want people to be educated about their finances and making good economic choices. And then in asset development, you want to make sure you're thinking about ABLE accounts as our newest asset building opportunity, but you want to be considerate that that might not be where everybody is at the start. So you'll want to be thinking broadly about this. You may have individuals who are not anywhere near a $2,000 asset limit in their savings. So for them, asset development might start with getting banked and having a savings account. And from there, they might be thinking about an ABLE account. An ABLE account is meant to be supported by the individual, opened by the individual. So if you are serving folks who are not at that place with their ability to manage their money, you might also want to be still thinking about pooled trusts as a way to help a person have support from an agency in managing their funds, and then an ABLE account could be a further out goal. So there's a lot of resources and tools that you can use, but this three-step process helps you start to think about what is the world of tools and resources that we want to look at. What do we provide ourselves? So what are we going to offer, whether it's something we actually offer or something we make a hard or soft referral to? And then where's the gap? What is the world of opportunities and services that we haven't quite aligned with that we want to make sure that we're supporting people to participate in? Those gaps are where you're going to find all of the best pieces. I wanted to offer a little bit of a personal experience. When I was starting out in this field, I recognized pretty quickly that I didn't quite know enough to be as effective as I wanted to be. And so part of the unofficial role I took on at my organization was the person who was understanding all of the different community resources that were available to people. And it wasn't that I had any idea of the value of a resource map or that I necessarily had a thoughtful strategy. It was really because I was new to the field and I knew enough to know that I didn't know enough. And so if you think about it, a resource map is a really great way when you're starting off in something new. You just want to be thinking about what is the world of opportunity that I want to make sure people are connected to, and then how do I find out about it? So in this analyzing of gaps, you're likely going to be wanting to start to reach out to some of the initial organizations that you identify. So if you're in a local area where, say, the United Way is providing a lot of the financial capability programs, or even if they're just providing VITA sites, they're supporting VITA sites, that would be a great entity to reach out to say, I want to better understand the world of tools and resources for people in our local area around their financial education and their financial capability. Who are the partners that I don't yet have in this resource map? And they'll offer a few to you, and then you'll start to reach out to those, and you want to see if you can ask them some of the same questions. Some of you may be tech savvy enough where you can make this a little bit of a community-wide engagement, and you might even choose to make this a bit more electronic and ask different groups, can you tell us about some of the resources you provide? Can you advise us of some partners that we don't yet know about? Or if some of you are doing group meetings around employment services, you might bring your resource map to that group meeting and ask other partners, other organizations to get involved with you. The resource map isn't something that's meant to sit with one person or to sit on a shelf. You want to make it something that's going to be a living, breathing tool that you can utilize. We highly recommend you keep it right on your desktop so that you can utilize it every time a customer walks in, or you could go a little bit bigger and make it something that is, as we're going to show you on one example, printed and available electronically to anyone in the community and anybody who walks in to receive services. The resource map is the way that you're going to stay connected to all of the services and tools that you may not know about now, but you're going to be wanting to make referrals to. But it's also a way for the disability community in your local area and the asset building community or the anti-poverty community to start working together and making those cross referrals, getting to know each other, and having a better working relationship. It sounds like a tall order for one document, but you'll find that once you set down this path, those connections are going to come easier and easier, and you're going to realize that the programs you're connecting with also have a mission to serve people who are very low income, and your guidance in how to do that better for the disability community is going to be very helpful to them. So we're going to go through a few resource mapping examples and resources, and I think Mike is going to take you through those examples.
Yes, thank you, Elizabeth. Brittany, next slide, please. Okay, so what you're going to see on the next few slides is an example of a resource guide or resource map for the Martinsville, Virginia area. And I have a couple different resources to review with you. The first one was developed by Virginia 211, which is the statewide Virginia's Referral Network. They put up a great guide that's broken down into services based on needs. So, for example, disability issues, crisis issues, employment, housing services, and so forth. Don't have the time to go there, but the link is there on the PowerPoint if you'd like to take some time on your own to go through that document. It's a really handy guide of some quick resources. And also, you know, Virginia 211 has statewide resources for the whole state. This guide that I have a link to is specific to the Martinsville area, but they do have resources for wherever you are in the state. So if you just Google Virginia 211, the site will come up and you can narrow down specific resources within your community. Next slide, please. Next slide is for the VITA site in the Martinsville area. For those of you that might not be as familiar, the VITA stands for the Volunteer Income Tax Assistance Program, and that's the free tax preparation program for people that make less than $54,000 a year. Not necessarily people that have disabilities, but people that are low income can go and get their tax prepared for free. Now in Henry County, where Martinsville is located, there's various VITA sites around the county for people to go to, and they are determined in November of each year. So probably by the end of this month, those lists of locations will be published. I've given you the phone number that people can call for more information if they want more details on where those sites are going to be. And again, this is specific to Martinsville, but there are several VITA program sites around the state that people that are low income can utilize. And the last slide for Martinsville is just a variety of other resources, solutions that empower people, which is the VITA site. They do IDA development, financial education. There are financial literacy seminars at the Martinsville Library. I put a link to the calendar there. What they do is they provide free financial empowerment classes for anybody who's interested. This month they're having a webinar on how to save money, or a seminar rather, on how to save money. So they do, I believe it's like one seminar a month on different topics. And then the last one is the United Way, Partnering with Hope, which stands for Helping Others Progress Economically. And they do money management mentoring classes. They work with people on budgeting skills, They do stress management courses, and I think we could all probably use that. They do have mentors that can help people set financial goals and come up with plans on how to reach those goals. Those volunteers and mentors have been trained in financial education and financial literacy, and they can work with people free of charge if they need help in setting financial goals or coming up with action plans to reach those goals, whether it be to work on a budget together or ways to accumulate savings. These mentors can give the clients some direction as to where to go for services. Next slide. I believe the next slide is Elizabeth.
Yes, thank you so much. So another resource map that we want to share with you came out of the state of North Carolina, and it was developed by National Disability Institute and the Collaborative, which is a statewide nonprofit that promotes strategies to build economic security for families within the state of North Carolina. And we were able to do that together with funding from the North Carolina Council on Developmental Disabilities. So the intent was to create a guide that would help the whole state of providers better understand asset building resources that are available at the local, state, and national level. And you can access the guide at this link. We wanted to make it available to you on this website, on this webinar. So if you're able to now, or when you're done with today's webinar, I really encourage you to click on the link and scroll through the resource guide. So there's two benefits to having the couple of examples that we provided to you. One is they're very different. So they give you kind of examples of, we gave you a tool to gather all of the information, and you might choose to keep the information in that tool, or you might choose to take it in a slightly different direction. And these are a couple of examples of ways people did that. But the other reason why these examples can be really helpful to you is that they open up your mind to a whole host of providers that you may not have thought about in this space, or that you may find also provide services in your own community. So when you look at things like CDCs, Community Development Corporations, and what they offer, those are available oftentimes in most communities, typically at the county level. So you can take a look at your county and see if what your county is doing by way of Community Development Corporation. Also, people are often timid about thinking about groups like Consumer Credit Counseling Services, but many of those groups are nonprofit, and if you are ever concerned about whether or not one is a safe one, we encourage you to send us an email at ask@ndi-inc.org, and we're happy to help you understand how to identify a high-quality, low-risk consumer credit counseling group. And then when you look at North Carolina's, they also give you entities at the federal level, so you're able to take a look at some of the groups that you may not have realized provide national services, and that can be a great way for you to then follow the lane down from the national level to the state level, down to your local level. Also in the North Carolina Resource Guide, when you go way to the back, they provide a couple of resources like a financial security framework. You once again get our NDI's financial security strategies and what they mean, and they offer a definition of services. So if one of the challenges you're thinking through as you head into this economic empowerment space is, how do I actually define financial education or financial counseling, or what an IDA is, those definitions are in the back of the North Carolina Resource Guide. So it can be a way for you to kind of increase your ability to talk about this without having to listen to, a bunch more webinars or not really know where to turn for good, high-quality definitions. We also hope that what you'll find in these two very different examples is that there's some common ground. There's some folks that are common players that you'll see, and one of those is 211. So if you have never, well, I think it would be unlikely that you're this far down the path and on the line today and have never heard of 211. But in case you haven't, 211 is information and referral, and they are available in almost every, if not every community across the U.S., and they are a place online that you can go to and search throughout your community. And at the local level, people can pick up the phone and call 211 when they're in need of services. And that's anybody, a service provider, an individual. They're a great resource and a great go-to entity when you need to create something like a resource map. And then if you have any challenges along the way, just remember that we're here to support you in the development of your resource map, and you're welcome to reach out and ask us questions. Importantly, we want to leave you with a few resource mapping tips. One, it's important to do this resource mapping activity with your colleagues and your coalition members, your consumers. You want to have diversity of perspective and diversity of knowledge of what the resources are that are currently available that folks know about. I also want to encourage you, one of the mantras that we have here at National Disability Institute is that it's okay not to know everything. Nobody can be expected to know everything. What you want to be, I think, or what we strive to be, is somebody who knows how to get the answer. And that's what the resource map is going to help you to do. It's not that you're going to open up this world and then know everything that's in it or remember everything, but you're going to be able to know who to turn to when a question comes up that you can't answer or when somebody needs a service that you don't provide. The second tip is to be patient. Resource mapping takes time. It's a work in progress. It's going to help you to build new relationships, but that relationship building is also going to take time. And we know that everybody on the line is very busy. We all have multiple, often competing priorities. So you want to be able to carve out time, but take it easy on yourself. Rome is not built in a day. Your resource map will not be built in a day either. And the third tip is that creating new relationships as part of this process is key. You don't just want a document that tells you who to turn to. You want to start developing the relationships so that when you do turn to them, they're going to know who you are and they're going to welcome your customers with open arms. So you want to be able to make sure that you're developing those relationships for the soft referrals, for the hard referrals, and as you move forward in this work so that you can do partnerships and blend and braid your resources to make sure that you're efficiently using your time, your resources, and providing a great customer service experience for the people that you serve. With that, I'm going to hand it back to Brittany so that we can see what questions you may have.
Wonderful. Thank you so much, Elizabeth, and thank you, Mike. I think this was just a huge amount of information to absorb, and you both presented a very, very complex subject very, very clearly, and this will, I'm sure, go a very long way in helping all of us on the line today do our jobs better by being better connected. So thank you. This is a reminder for those of you who have not gotten a chance to submit your questions via the chat box to please make sure to put them in now because we are going to be starting to go over a few questions. The first one is, will the assets development folks know who we are in the disability community? And I think that that is a great question to start out with because, you don't want to feel like you're cold calling, but I will turn this over to Elizabeth and Mike and see what their thoughts are.
Great. So Mike, do you want to take this one first, or would you like me to?
Well, I can point out, like in my own experience, like our WISAs who are working with people with disabilities, especially people that are individuals who are not affiliated with agencies, have come to me and said, I'm having a tough time getting referrals, and how do I present my services in a way that will encourage the VR counselors to refer to me. I think outreach is the key. I always tell them, go to the offices or call the manager, just introduce yourself, explain what you do, explain the services that you provide, sell it in a way that makes the VR counselor understand what it is that you're trying to provide and what goal you're trying to achieve by providing these services. So I think that one of the ways, if an agency that you're working with or calling as part of your resource guide doesn't know you, don't be afraid to pick up the phone, just introduce yourself, explain what you do, and what you're trying to accomplish by putting together this resource guide. I think in many cases you'll find that a lot of the people that you're working with to put together these resources are more than happy to help.
That's a great suggestion, Mike. And it's Elizabeth. I'll just add to tell you pretty bluntly that it's likely that they will not know who you are. I'm about 12 years at this blending of financial capability and disability work, and I often find that given the area, there will be folks on the disability side who haven't thought much about economic empowerment or financial capability, and there will also be people on the asset building side that haven't thought much about how to better serve the disability community. So you may find that there's a gap in knowledge, and I just want to encourage you to remember that you share a mission, and the shared mission is to support low-income communities to have a better financial standing, to have financial stability. And if you help them recognize that you're serving a population of low-income individuals who would benefit from their services, and that you are available to answer their questions if they're not quite sure about how to serve people with disabilities, you're going to be off to a great start. And if you have deeper questions, we do have some archived webinars we can refer you to, but also you're going to have contact information in just a minute for Mike, for myself, for Brittany, and for David Leone in Virginia, who isn't a speaker today, but is leading this effort in the state of Virginia.
Wonderful. Thank you so much, Elizabeth. And we did have a question come in from someone that said that, we know groups change over time and resources and organizations are always up and coming. So how often should a resource map be updated? And I think the answer to that question is actually in the question itself.
Great point, Brittany. Yep, you're going to want to make sure that you update. It's not necessarily that you want to update your resource map frequently. It's that you want the resource map to be a living, breathing document. So as you're engaging with your staff internally, or if you bring this to a community-wide effort, as you're re-meeting with those work groups, you want to make sure that you're identifying a way that you're going to keep the resource map updated. And that may fall to one group or one person. It may happen annually. That wouldn't be terrible if it happened annually, but you do want, as part of your resource map creation, to be thinking about that very thoughtful question: when am I going to update this again? Or how am I going to make sure that as new resources are uncovered, that they're being added to the map?
Great. Thank you, Elizabeth. And I think we have time for one more quick question. So we will wrap up with, in Virginia, how do I learn more about the CFPB training you referenced earlier? And Mike, I believe this was in reference to the beginning of the training when you referenced the Your Money, Your Goals training that several participants were part of a couple months ago.
Sure. My best advice would be to Google the Consumer Financial Protection Bureau, Your Money, Your Goals. If you do that, the link to the Your Money, Your Goals website will come up, and it'll have all the tutorials on the tools, as well as give you an opportunity to order hard copies of the toolkits that you can order and use in your organization. So you do have the ability of obtaining Your Money, Your Goals toolkits online, both in electronic and hard copies. And another thing that I wanted to point out is that I will be conducting a series of webinars on Your Money, Your Goals. Each month throughout the fall and winter, I'm going to be doing a webinar on a different module in the Your Money, Your Goals toolkit. So those webinars will consist of me just explaining the different tools and demonstrating examples of how you can use them with the clients you're working with. So if anybody is interested in attending those webinars, or if they want more information on how to obtain the Your Money, Your Goals tools, just shoot me an email and I would be glad to send out an invite to anybody who is interested.
Wonderful. Thank you so much, Mike. I think that would be a great resource to end our resource mapping webinar for the day. I have on the screen right now the contact information for Elizabeth and myself and David and Mike. And I just want to put a quick reminder, and if you have not had the opportunity to join NDI's REI network, we have a ton of free webinars and tools that Elizabeth shared during the beginning of the webinar, and we would be thrilled for you all to join so you can continue to learn more about financial capability and things like resource mapping in the future. And I just wanted to remind everyone that our next webinar, there's a little bit of a gap now between this webinar and the next one. It's going to be December 7th from 2 to 3 p.m. Eastern Time. And there is a link to reserve your seat now. And we will also be sharing that via an email. So, and as Mike said, please be sure to share with your colleagues as appropriate so they can learn more about the financial health assessment for counseling and guidance as well. The archive from last week's webinar will also be coming soon, and we will be sure to share that out via an email. And with that, I will be ending the webinar here. And thank you to everyone for your great questions that you had. Thank you again to Mike and Elizabeth for a great presentation. And we look forward to seeing you all very soon. Thank you.